Hundreds of young people urgently needing a mental health bed are struggling to receive the care they need, close to where they live. This video presents a summary of our research that looks at the experience of some young people who are admitted into hospital because of their mental health. Adolescence is a time when many young people struggle with their mental health. For those with severe mental health problems, if things become too complex or unsafe for them in their daily surroundings, the decision is made that an admission to a mental health unit is needed. However, the number of child and adolescent mental health beds is low and vary in location throughout the country. This means that many young people face being admitted to mental health units far away from their homes or to adult mental health wards. Little research has looked at these experiences, so our understanding of what is happening is limited. The Far Away From Home research study was carried out to understand and improve the experience of care for young people who require admission to inpatient mental health services. In this animation, we summarise the results of this work. We analysed data collected over a 13-month period about young people who were admitted either to a general adolescent unit located far away from home or to an adult ward, to explore who it affected and how young people got on over a 6-month period. Based on the 290 reports that we received, we found that the average age of patients being admitted far away from home was just under 16 years old. 73% of the patients were female. Most of the patients identified as belonging to a white ethnicity group. 84% of the patients had previously been known to child and adolescent mental health services, with 63% of these having been known to the service within the previous 6 months. 81% of admissions were emergency admission requests, with 53% of these involving the Mental Health Act. The most common concerns resulting in an inpatient stay were suicide risk and difficulty managing strong emotions. The most frequent diagnoses reported were depression, autism spectrum disorder, and psychosis. In 73% of cases, the reason for admission far away from home was because there were no beds available locally to where the young person lived. For 22%, other issues meant the young person could not be admitted locally. For example, the unit did not offer the specific treatment needed. Of the 279 patients admitted to general adolescent units, 38% of young people were admitted more than 100 miles away from their home, and a further 8% more than 200 miles away from home. We found that 41% of the young people waited more than a week for a bed to be available, and of these, 55% waited in the general hospital setting. Once admitted to a mental health ward, the average length of stay was 76 days for those on adolescent wards, or 36 days for those admitted to an adult ward. However, 20% of young people were still in hospital after 6 months. A longer time in hospital means more time away from family, friends and school. The fact that discharge was delayed for over a third of these young people means that they spent even longer away from these important support networks than necessary. Service developments to mental health crisis care provision in community settings and more intensive therapeutic input for young people waiting in general hospital settings could help to address some of the challenges we've highlighted. More information about this study can be found on the ARC website and in our recent publication in BMJ Mental Health.